Breast cancer treatment Rambam's mixture. History, facts, and Jewish medical tradition. The treatment of oncological diseases, in particular breast tumors, has always been a serious challenge for medicine. In the history of healing, a special place is occupied by the contribution of Jewish doctors of the Middle Ages, among whom Moses ben Maimon, also known as Rambam, stands out. His works on medicine and pharmacology had a significant impact on the development of medical practices, including the treatment of tumors of various origins. In this story, we will consider the historical aspects of the use of the so-called Rambam mixture for the treatment of glandular tumors and breast cancer, as well as the role of Jewish doctors in the dissemination and development of these methods. Moses ben Maimon, 1135 to 1204, known in Europe as Maimonides, was an outstanding philosopher, physician, and theologian. Born in Cordoba, he spent most of his life in Egypt, where he held the post of court physician to the Sultan. His seminal medical works include the Pharmacopoeia, Kitab al-Tiryak, the treatise on poisons and their antidotes, and the medical aphorisms. Drawing on ancient Greek and Arabic traditions, Rambam viewed medicine as part of the Jewish religious obligation to care for life and health. His works detailed methods of diagnosis, diet, herbal medicine, and the use of complex medicinal mixtures, which he believed would harmoniously combine to affect the entire body. In Rambam's time, tumors were referred to as sheken, and Jewish medical texts included descriptions of both benign and malignant tumors. Particular attention was paid to tumors that arose in the mammary glands of women. The works of Rambam and his contemporaries contain advice on diet therapy, bloodletting, compresses, and the use of complex medicinal mixtures. Rambam noted that glandular tumors of the mammary gland are often accompanied by pain, compaction, and sometimes ulcerative changes, symptoms that correspond to modern descriptions of cancer. In this regard, he developed not only local but also systemic methods of treatment. Many traditional recipes attributed to Rambam contained combinations of plant, mineral, and animal components. One of the famous mixtures included the following ingredients: a myrrh, a resinoid aromatic substance with anti-inflammatory and antiseptic action. A aloe was used to heal ulcers, reduce inflammation and pain. A saffron, valued for its antioxidant properties. A pomegranate peel was used as an astringent and a source of tannins. A honey, a natural antiseptic and immunostimulant. A wine or vinegar, as a solvent and preservative, and to enhance the penetration of the substances. The mixture was prepared by infusing the components, then straining and applying both orally and externally, sometimes as compresses or ointments. In medieval Jewish communities scattered throughout the Mediterranean, mixtures based on the works of Rambam were used to treat various types of tumors. Jewish physicians such as Isaac Israeli, Abraham ibn Ezra, and others adapted and developed these recipes, often combining them with Arabic and Greek medical practices. For example, letters found in the Cairo Geniza contain references to Jewish women receiving special mixtures and compresses for glandular and ulcerative tumors of the breast. Practitioners noted a gradual reduction in pain, a decrease in inflammation, and in some cases, the resorption of the growth. Jewish doctors were respected and trusted by Jewish, Muslim, and Christian communities alike. Their approach to treatment was comprehensive. In addition to using mixtures, they recommended following a special diet, limiting the consumption of certain foods, fatty meat, wine, and using moderate physical activity and water treatments. In some cases, surgical intervention was recommended, but due to the limitations of surgical methods and the high risk of infection, doctors preferred conservative therapy. Mixtures based on Rambam's recipes often served as an alternative or supplement to surgical treatment. One evening spent studying family archives, I came across the carefully bound diaries of my ancestors, Jewish doctors who served in different parts of Europe. Leafing through the pages, written in neat handwriting, I discovered something astounding: a detailed description of the famous Rambam mixture used to treat glandular tumors and breast metastases. Thanks to access to the works of ancient and Arab scholars, Jewish doctors of the Middle Ages were famous for their erudition and practical skills. They not only read and translated the works of Hippocrates, Galen, Avicenna, but also carefully conducted their own observations, recorded recipes and methods of treatment in their notes. In the found notes, the description was given a recipe for a mixture that Rambam recommended for the treatment of the most complex diseases, glandular tumors, including breast metastases. The composition of the mixture is original and balanced. According to the descriptions, it included extracts of rare plants, essential oils, mineral salts and drugs known for their anti-inflammatory effect. No less important was the technology of preparation, adherence to strict proportions, long infusion and filtration, which, according to the authors of the diaries, ensured the high effectiveness of the drug. Documentary evidence provided in the diaries confirms that Rambam's mixture was widely used by Jewish doctors in Spain, North Africa, the Middle East, and even Italy. This is reported both by medical notes and by letters of thanks from patients. The treatment of tumors in those days was associated with many difficulties: the lack of modern diagnostics, limited surgical options. This is why drugs with anti-tumor and strengthening effects were of particular value. The mixture was used not only for internal use, but also as part of compresses and ointments. The doctors recorded the results in detail: a reduction in the size of tumors, pain relief, and an improvement in the general condition of patients. The records show the main feature of the Jewish medical tradition: the desire not only to cure, but also to maintain a decent quality of life for the patient, an individual approach and attention to the emotional state of the patient. The diaries describe how the preparation of the mixture required not only knowledge, but also a special ritual, prayer, strict adherence to cleanliness, and the use of only fresh ingredients. The doctors noted that it was this spiritual component that enhanced the effect of the medicine. The diaries emphasized that before starting work, the doctor would say the words, "Chazak ve'ematz," a phrase filled with the energy of encouragement: "Be strong and courageous." This was followed by a special prayer asking for wisdom to be sent to the doctor's hands, for the purification of the mind and soul, for the protection of the patient from fear and despondency. At this moment, something important was happening: the mixing of human knowledge with faith in a higher principle, the unification of the material and spiritual. It was believed that strict adherence to the ritual allows the medicine to gain real power, and the soul to tune in to healing. Cleanliness, not only physical, but also spiritual, was a prerequisite. The doctor did not allow any random people to participate in the preparation process. Even family members could only silently watch. Water for the mixture was collected from a spring at dawn. Only those herbs were chosen that had not known the touch of a hand after the rain. This emphasis on freshness and pristineness symbolized the beginning of a new life, renewal, resistance to disease. Each plant for the mixture was selected with special care. The doctor knew in what place and in what season the herb would have maximum power. It is no coincidence that the descriptions in the diaries indicate the medicine must be collected alive. The patient was also prescribed to maintain cleanliness during the treatment, not only of the body, but also of thoughts, in order to be worthy of receiving such a medicine. Rambam's mixture is just one example of the complex and well-thought-out remedies developed by Jewish doctors. The fact that it was preserved in family diaries and numerous references in medieval medical manuscripts speak of the high esteem in which the knowledge accumulated in the Jewish environment was valued. The desire to find new methods of treatment, a critical attitude to the legacy of their predecessors, and care for patients allowed doctors of that era to occupy leading positions in medical practice in Europe and the East. The discovery of the recipe for Rambam's mixture in family archives was not only a unique historical event, but also a reason to think again about the richness of medical traditions. This is evidence of the high level of skill, the desire for innovation and deep humanity inherent in the medical philosophy of Jewish doctors of the Middle Ages. The uniqueness of the mixture is confirmed by its composition, practical action, and place in history, and the memory of this experience continues to inspire the modern generation to search for effective and humane methods of treatment. Modern science confirms many properties of the mixture's components: antioxidant, anti-inflammatory, immunostimulating effect. Although these remedies cannot replace modern methods of therapy, surgery, chemotherapy, radiation therapy, interest in historical recipes remains within the framework of complementary medicine. Research shows that some plant components are able to slow the growth of tumor cells in vitro, but clinical evidence of the effectiveness of such mixtures for malignant tumors is insufficient. Nevertheless, Rambam's comprehensive approach, combining diet, pharmacology, and care for the patient's mental state, is reflected in modern principles of integrative medicine. Rambam's mixture for the treatment of glandular tumors and metastases of the mammary gland is evidence of the high level of medicine of medieval Jewish doctors, their desire to find effective methods of treatment and care for the quality of life of patients. The contribution of Rambam and his followers to the development of medical science remains relevant today, inspiring the study of ancient knowledge taking into account modern realities.